Hi, my name is Jessica.
And I'm Brittany. We're fourth semester practical nursing students.
Today we would like to discuss our nursing toolbox that you would need going in further into your career.
So these are just some tools that we found to be very helpful um, throughout our clinical rotations. So the first tool we decided to include in our box is a stethoscope. We found this tool to be very important because you use it throughout all of your assessments. For example, in your respiratory assessment, you're going to be listening to your patient's lung sounds. Cardiac, you're going to be listening to their heart sounds. In order to take blood pressure, you need to use the stethoscope, as well listening to bowel sounds. This tool is very important to know what's going on with your client in the clinical setting. It helps you determine if there's a change. Sometimes you might not always be able to see a client's change in their condition, but by listening to their hearts, listening to their lung sounds, listening to their bowel sounds, it really helps you establish that change in that particular client. So that's the first item we decided to include.
Our second item is a box of black pens. Most agencies require you to record your documentation in black pen, and that is exceptionally important because you want your documentation to be legible and very concrete for future situations when other people need to read it for reference. And you want a whole box because you tend to either lose pens or they grow legs.
The next item we decided to include is our Jarvis physical examination and health assessment. This is going back to semester 2, where we learned health assessment. This is really important to have on you because specifically in fourth semester, you are beginning to work with your medicine and surgical clients, and your head to toe is it needs to be accurate. So if you're not sure about a specific assessment, you can refer back to this book, and it has everything from landmarking to subjective objective data. I think we both used this in the clinical setting, and we found it very helpful. So we decided to include that in our toolbox.
The next item in our toolbox is on the topic of self-care, compression stockings. These will keep you and your tired legs going. You can also, maybe you have a little note of individuality. I have panda bears on mine.
And then again, for self-care, we've also decided to include a water bottle and a granola bar. This is really important because when you do get into the 12-hour clinical rotations, it's very busy, very fast-paced, and you want to make sure you're taking care of yourself. In order to take care of others, you need to first take care of yourself. So it's very important to stay hydrated and have some nutritious snacks with you.
Our next item in the box is our reference cards for the codes, because there are a lot of code colors and sometimes it's hard in the heat of the moment to remember what particular color means what. So it's nice to have this attached to your name badge every shift. So if they say call a code green, you know it's an evacuation. Also additionally, for reference, you have the PPE instructions, and this came in our lab kits, and this is also nice to have attached to your name badge so that if you can't remember, you can always refer to this badge.
Right. And then next, we decided to include cue cards. Me and Jess both made cue cards for every single rotation. So in the cue cards, we included common medications we would be giving on the unit. We included are assessments that were specific to that unit. So, for example, mental health, you would include your mental status exam, OB, your bubbles assessments, and then just kind of tailor the medications to the unit you're on. These are really nice to have because you can keep them in your scrub pocket, even starting out in your first placement, which was long-term care.
Mm-hmm.
You're still familiarizing yourself with normal vitals, normal, abnormal lung sounds. So it's really nice to have these. You can just pull it out and you have a reference to go to right away.
So our next item in our toolbox is, of course, Mosby's drug reference. This is excellent to have with you because a lot of the time, well, not a lot of the time, but when you're first starting out, you're going to have a lot of questions, particularly pertaining to medications, such as allergies, interactions, um, and just general suitability for an individual, maybe geriatric dosage versus an adult. It also has your dosage calculation formula in here. It has all your abbreviations, so if you have a moment where you can't remember what HS means, it's in the back of the book. So this is like an excellent tool to have with you. Mm-hmm.
And then next we have a watch, the nurse's watch. So this particular one is a glow in the dark, which is great because if you're going into a room and it's dark, you can see the time, you can see when you're taking pulses. You might not always have access to a clock in the room. So when you're taking a pulse, this is very important to have. Blood pressure is all that very important to have.
Another thing that I would have in my toolkit is a screamer. Most facilities do have a policy surrounding the screamers, particularly having one attached to you at all times, not only for your personal security, but for the patients as well. So if there is a situation where you need assistance, you can just pull it and hopefully somebody will hear you and come and assist.
And then next we have a blood pressure cuff. So most of the agencies do have vitals machines as well as disposable blood pressure cuffs, but sometimes you're not guaranteed that they're going to have that. Also with power outages, technical issues, you always want to make sure you have this so no matter what the circumstances are, you can take a client's blood pressure.
Okay, and I think our final item is the pen light. This is an excellent tool to have around because not only can you do your PERLA assessment with it, you can also investigate other things that might need a little extra light. Maybe the room's dark because of patient's preference. Maybe you're on night shift and you don't want to wake them up by turning the full light on. So this is kind of nice to have, and I'm sure I'll find many, many more uses for it. Okay, so that concludes the portion of the actual individual items in our toolbox. So now that we've concluded the portion of the physical items in our toolbox, we would like to go over some of the knowledge items in our toolbox, which we would also like to bring with us into our nursing careers. The first one is the CNO Nursing Code of Conduct. So this contains 6 principles of the code and goes into more detail, such as the nurses respecting the dignity of patients and treating them as individuals, nurses working together to promote patient well-being, nurses maintaining patients' trust by providing safe and competent care, nurses working respectfully with colleagues to best meet patient needs, and also nurses acting with integrity to maintain patients' trust, and lastly, nurses maintaining public confidence in the nursing profession.
Okay, and then the next is the CNO professional standards. So these standards touch on accountability, continuing competence, ethics, knowledge application, leadership, and then the relationships, so the therapeutic nurse client relationship as well as professional relationships. Um, Specifically in the clinical setting, the knowledge and knowledge application is very important because you need to ask yourself, do you have the skill, knowledge, and judgment to be caring for your clients that you're going to be caring for? You are learning, but you still are accountable for the outcomes of your clients in the clinical settings. And you need to make sure that, even with our toolbox, that you do have those tools. You are practicing your head to toe assessments. If you're not sure, you're looking to your drug reference book and your physical examination book to make yourself more knowledgeable, and that you're also professional. So you're showing up to clinical with a good attitude, with your name tag on, you're introducing yourself to your clients, and you're being professional towards staff, so respecting the staff. We believe that those professional standards are very important.
The next one we would also like to focus on having in our toolbox, our knowledge toolbox, is the authorizing mechanisms, which contains our scope of practice, our controlled acts, initiation, and delegation. So specifically that wonderful list that we must adhere to and be responsible for of items that we can and cannot do. That is exceptionally important, and it is totally on us to abide by it and be knowledgeable of it. So the next one that Brittany is going to discuss is medication.
So we printed out these 3 documents from the CNO, and these are just decision trees about medication administration. So this is what you, as the nurse, would ask yourself while administering medication. So is the order clear? Is the order complete? Is the order appropriate? Is the order clear, complete, and appropriate? And then it just has what you would need to consider and what you would do if in the instance that no, the order wasn't clear, or no, the order wasn't complete. It's just really great to have this, so that way you have a guideline as to what your next steps would be. And then we have a decision tree regarding medication administration. So with medication administration, you need to practice the 10 rights of medication administration as well. This is just some decisions to follow. So this is something that you can have with you, and you can say yes, 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 or no, no, and then it kind of tells you when you shouldn't be administering the medication and when you should. So for example, are proper mechanisms, authorizing mechanisms in place? For example, is there direct order or directive? Do you have the competence to administer this medication? So do you know why the client's getting this medication? Are you sure that you have the right dose? Again, following those 10 rights of medication administration. And then it just says, have you assessed environmental supports? And then administer medication, and then evaluate outcomes as well. And then no, you would not obviously administer the medication. These are really nice to have with you, because if you are, you're not sure, or you're not, you can look back to these, and it has clear guidelines as to whether or not you should administer the medication, or when you're looking at the order specifically, if you should complete that nursing intervention.
Okay, so lastly, we have our confidentiality and privacy personal health information standard from the CNO. This covers information such as the Personal Health Information and Protection Act and Quality of Care Information Protection Act, and issues such as disclosure. So if you have any sort of situation where you're questioning whether or not to disclose certain information or who you can share it with. This document will have your answers and hopefully guide you in the right direction if you have further questions. And that concludes our portion of our knowledge resources for our nursing toolbox.
Thank you.